Okay, thank you everyone for coming today. I'm really grateful to bring some significant news, something that's been over 10 years in the works. And so this is exciting. Thank you, delegates, for showing up today. Both of you have been very involved for a very, very long time. You know, I think a lot of you may have noticed we've been trying to get around West Virginia, and we've had a number of big announcements. We're excited with the direction that the state is heading. Just last week, it was my honor to name the newest member of the West Virginia Supreme Court, Thomas Ewing. I'm hopeful he's going to do a very good job. Today, we have another big announcement related to state government. You know, when I took office, one of my first charges was to ensure that we could dive in at the way state government was operating, and we could look for efficiencies and new ways for taxpayers to have money saved. On day one, I signed an executive order directing agencies to develop a plan for more efficient government. And I'm proud to report that we're already seeing dividends on that. You saw that in the recent numbers that came in. A lot of the good work that happened in the past, then we did our part as well, driving efficiencies that were reflected even in the first 6 months that I was in office. The difficult decisions I made when I proposed a fiscally conservative 2026 budget, the vetoes I made, and the direction I gave my cabinet on a day one to find efficiencies, that's all part of the process in helping us run a more efficient state government. I'm pleased with the first 6 and 7 months. I think we're off to the new fiscal year in a very positive manner. But let me say there's a lot more work that needs to be done. We still face significant future financial challenges. That includes additional changes to baseline on PEIA, and we'll talk about that in a bit, between $35 and $49 million in terms of increase on baseline for the fiscal year 2027 budget, absent changes. We're hopeful we will have changes. Between $170 and $194 million pertaining to education cost, Hope Scholarship, as that gets fully implemented in 2027. Monies related to the tax bill that recently passed in DC could have an impact on us. And obviously there are always other changes that occur year to year within state government. So we always have to be looking for ways to reduce long-term cost. And that brings us to West Virginia's healthcare facilities. Right now, the state of West Virginia owns and operates 4 long-term care facilities that have 511 licensed beds. Not all of those are in use, but that's what they're licensed for. And that's facilities in Terra Alta, Hopemont Hospital, Jackie Withrow Hospital in Raleigh County, John Manchin Senior Healthcare Center in Fairmont, and Lakin Hospital, which is in Mason County. As I mentioned, for over a decade, the state has been pursuing a process to sell these facilities to a qualified, reliable investor. The sale of these facilities would produce a significant amount of revenue for the state, spur investment in the renovation and expansion of these facilities, and I think increase the level of quality of healthcare that's provided to patients. We also believe that all of this can be done in a way that preserves many jobs and retaining a lot of the staff that have been working hard for many, many years to provide care for their fellow West Virginians. But a sale of these facilities will also relieve the state of significant financial strain. Each of these facilities currently operates at a loss and needs serious capital investment, renovation, and in some case, wholesale transformation. To adequately address these long-term issues, the state would need to invest over $100 million over the next few years in rebuilding and renovating these facilities. Furthermore, even if the state invested this money, the long-term operating cost, they're only going to continue to rise. But they'd rise without substantially improving the level of care that's provided to the patients. Not a good mix. If we sell these facilities, we would allow the state to avoid a lot of these long-term costs, and I think we can work to lift quality up. So, after a long and careful process that's been going on for a very, very long time. With a lot of internal and external vetting, I'm excited to announce that we have selected the MarkX Development Group as the best candidate to purchase and invest in these facilities. MarkX Development Group, or MDG, has agreed to purchase these assets from the state of West Virginia for $60 million. And in addition, as part of the deal, MDG has also agreed that it would be investing in West Virginia to construct new facilities that will replace those aging and costly structures. They will be building a minimum of 3 and up to 5 facilities, new ones. This is terrific. That's a lot of extra value, more jobs, and higher quality for people. MDG is also committed to sourcing the labor and material for this construction from within West Virginia, which is outstanding. So this is terrific news. And not only will this address some of the pressing maintenance concerns at these properties, but it's going to provide a long list of modern, high-tech medical services to patients who are in need. MDG is proven to be highly effective. They're a patient-oriented owner, and they're an operator of similar long-term care facilities in states around the region. They own and operate 55 properties, serving over 5,000 licensed beds. They operate right now in 5 states, and Indiana, Michigan, New York, Ohio, and Kentucky. I think they're going to bring a breadth of resources to the table with so many of their staff combined with the people that are doing work on the ground right now. Now, when I look at this issue, I look at it as part of the broader effort that I talked a lot about on the campaign trail. I want to repurpose what state government looks like. You know, there's certain roles that we have for state government and things that the government uniquely needs to do. But there are a lot of functions that, quite frankly, are not performed efficiently by the government, nor should they be. We identified this as one of them, and then we went through, we built on the work that was done in the past, and we brought this to closure. This is meant to drive efficiencies, to build on the strength of partnerships with the private sector, and once again, to continually tell taxpayers that we're going to be a good steward of their money. Private sector is going to work on private sector things. The government works on government things. This is a good example of that. You'll be seeing more examples of that into the future. But when it comes to these facilities, I can tell you our top motivation is what was good for West Virginians. And I can assure you that's our top priority. I ask questions about quality every single day, and I made that a priority when choosing the investor. Obviously, we believe we're able to obtain a good result in terms of the specific dollars, the $60 million, but also the investments, which will be quite considerable and will inject needed help into our economy. The other point I would make is that this deal is likely to result in keeping a substantial portion of those jobs. That people that were working at those facilities, they've indicated that most of those people are going to keep their jobs. That's terrific. So we're excited about that as well. And so no matter how you slice it, it's a win-win-win for West Virginia. I think the current and future residents are going to be provided with the high-quality health care that's needed. The state's going to realize resources right away. It's going to get significant investments for new facilities into the future. And we're going to cut down on some of our operating costs. This is good. This is what state government should be doing. It took a lot of time on our team. I want to thank the people that are working so hard. I know Curtis Capehart is here today. Curtis has been working hard on this. Our chief of staff, Tom, has been working on this. Mike Caruso, the head of facilities, healthcare facilities, he's poured a lot of time into this. And obviously some of the outside help that we had through the investment banking and the outside law firms. They've worked hard on this for a long time. I know in the last few months I've had a number of meetings trying to bring this to closure, and I keep asking about quality and obviously maximizing the resources for the state. That's what we've done here. And what a process it's been, right? We started a couple of years ago with over 140 parties. that originally had contacted the state of West Virginia. There were 62 NDAs that were signed, 8 letters of intent, and now as we got down to the final numbers, we found a group that we were very comfortable with. So I want to say thank you to everyone who was involved in the process. This is terrific, and this is just the beginning of more efforts we're going to have to find efficiencies in state government, but do it the right way while protecting people that are most in need. So I'm happy to be here today to talk about this. It's a big development after a long period of time, and I'd be happy to answer any questions that the media has. Stephen.
What will this mean going forward for the Department of Healthcare Facilities? We have obviously HHR split into 3: health, human services, and health facilities.
Yeah.
A big part of that, I think, was obviously them doing investigations. Whether they could do the sale, which you just talked about here. Will that be part of a plan maybe for the next legislative session to begin to wind that down?
So we still have a number of facilities that we haven't sold yet in terms of the hospitals, so we're looking at that. But naturally, the way this process evolved, it made sense to sell the first 4. So there still are going to be a number of the remaining facilities that for now are under the auspices of Department of Health Facilities. But, look, I'm always looking to save resources. The long-term goal of that is to eliminate most of the need for that department. And that would be good. Look, it's no secret that I want to reduce the number of departments and reduce the number of agencies to drive efficiencies. So in consultation with the legislature, I will be happy to have those conversations and look at different ways we can keep saving resources. I know that some of the other facilities that we haven't sold, we're going to keep pursuing potential sale of those and look at different ways that that can be handled the right way, because all those facilities are different. Some are in different financial straits than others. So, I don't want to forecast what the finances are going to look like, because some of those have been required heavy subsidizing from the state. And I think some of that will continue into the future. But look, I'd like to make as many changes as possible to repurpose government and get rid of these facilities. The government's not very good at delivering health care. I think that if we can hand that off to groups that do this every day and have demonstrated success, that's the direction we need to go in. Sure. Yeah, hey, Anna.
How will this be communicated to the patients, and what will that transfer look like
for
them in terms of their insurance coverage?
Well, we plan to clearly communicate it to the patients, and I think it's going to be very seamless. My hope is that the patients are going to be very happy that we're looking at not only the transfer to the private sector, but we're looking at the build out of new facilities, which is great news. And so from a quality perspective, I think it's going to be positive. But, we will be alerting them and letting them know in all the appropriate ways in the upcoming weeks and months ahead. I know that we have a closing that we have to get to. We're positioned, we signed the paperwork. The closing, Curtis, what's the closing date? September 30th with a possible 30-day extension. So this is happening very soon, but we're going to let people know that it's coming, and we'll do everything to work with the new owner to have a smooth transition. Lori?
Yes, when you say that there's going to be new facilities built, are those in place of the hospitals that are there now?
So these are the long-term care facilities. These aren't the hospitals, but when I say the new facilities, they'd be meant because a lot of these aren't as good a condition as we like, so that presumably they'd be located right in that very region. So they'd be new build-outs. So that's what we mean. Questions? WOWK?
Yeah, Sarah Davis.
Hey, Sarah.
So you're bringing in a secondary sector to this. How can you ensure that the healthcare facility are still going to have that West Virginia home feel, that the patients are still going to feel that they're being taken care of?
Yeah, it's a great question. So that's why we emphasize quality so much in the process, because we want them to make sure that people know that they're going to have folks taking care of them. Many of the people staffing it, they said substantially all of the people staffing it are going to remain people that were working for those facilities. So I think that transition is going to help a lot. But I also think that having the ability to invest in new facilities, that's going to be a big plus for these communities. These facilities are cornerstone of these communities. People really rely on them, and I think it's only a plus up for the communities that they're going to see new investment, new jobs, new opportunities, while I think a higher level of quality.
Has
Sure.
this company also expressed interest in the other facilities?
So we're continuing to work on the other facilities, and so I don't have a timeline to talk to you about that. My focus right now has been on selling these 4, because I think that's the interest that we had, that folks were looking at kind of this cluster as opposed to all of them together. But after we're done with this, we'll roll our sleeves up and we'll keep doing more and more. The work of creating efficiencies in government, it's never going to end. And I can promise you that every day I'm challenging my team to do more with less. Because at the end of the day, I want West Virginia to win that backyard brawl. And that means we have to be faster, stronger, better than the other states. That's speed to build, creating the best type of regulatory culture, eliminating red tape. It also means long-term trying to lower our state income tax, become more competitive with other states that we touch. The only way all that happens is if you make the tough decisions to make government run more efficiently, and we're certainly demonstrating that. And I do want to thank the legislators for being here. We're having a separate meeting upstairs, and I'm glad you came down. Thank you for your support. Stephen.
Obviously, you're a big proponent of eliminating the certificate of need for healthcare facilities. Do you foresee any hurdles that this company will have to go through to do this? Do you think some of this will get grandfathered in? Where do you see that, especially in light of the fact that you're a big proponent for eliminating the certificate of need?
Yeah, I know that right now these transactions will go on. I don't see any hurdles right now to where we are. I think that's going to proceed. I look at that as kind of a separate issue that the legislature, may take up again in the future. But I don't think it's going to impact the sale of these facilities right here.
Is this type of thing you need legislative approval for?
No, we were provided that authority by the legislature in the past. I don't recall what year, Matt, you may know what year that was, but we feel comfortable we could take action on this given the authorities that were provided to us.
Where will the money go from these sales?
Well, certainly we're going to be wanting to have discussions with the legislature and others, and that's the way the process works, right? The legislature appropriates, and then the executive decides whether to accept that or not, and there's a back and forth, and we certainly have great respect for the legislative process, and this will be subject to those discussions the way any dollars would be subject to it. Any other questions that folks have? Hey, Lori. Sure. But my only promise is this. Sometimes people ask off-subject topics, and then the next day the only thing I read about is the off-subject topic. But go ahead, Lori, please.
I plan to write about this too.
Okay.
I get it. There was a federal request for SNAP data.
Sure.
For a bunch of our
Yeah.
all our SNAP recipients. Does West Virginia intend to comply with that and give over personal information?
So I had read about that, and some people were talking about that. So I'm going to look further into that. But I can say conceptually, we want to help what has been articulated as the Trump administration's purpose. The goal that they have is to root out fraud, waste, and abuse, and to go after undocumented aliens. And I think that they want to look at a number of the public programs, including SNAP. I'm supportive of that. And so obviously you always want to protect the privacy of citizens, but there's a real issue ensuring that we're going to be have the adequate details to go after fraud, waste, and abuse, and to make sure that undocumented aliens and other people are not taking advantage of these benefits unlawfully. So my inclination is to work closely with the Trump administration on that and make sure that we're giving them the tools they need to limit bad use of taxpayer money. So that's where my inclination is, and I think that's the direction you should expect us to go in. Any other questions? Well, I hope this constitutes another big announcement. We really appreciate you coming today, and we'll be back in touch with you very soon. Thank you to everyone in West Virginia.